Salimonani, Makadini, hello fellow Zimbabweans and those across the globe. I want to take this opportunity to officially welcome you back to the Nango TV channel. Thank you so much for stopping by. On this channel, we are going to be sharing reviews, analysis of policies and laws, emerging issues and developments which have an impact on CSO's operations and the general citizenry participation, among others. Today, we have Professor Rudo Makunike Mutasa, who is going to shed more light on the deadly coronavirus, demystifying the myths surrounding the virus, and the already developed COVID-19 vaccinations.
Thank you very much, Chairperson, Ms. Mumbere. May I start by acknowledging your presence and the presence of other members of your executive, and also to thank you for this very kind invitation and an opportunity just to share a little bit this afternoon some of the important things that we might need to know about COVID, and also to thank Mrs. Musiwa, who contacted me and extended the invitation. So thank you very much. I also would like to congratulate you, Madam Chair, for organizing such a session, because as you were saying in your preamble, that you as non-governmental organizations are at the forefront of everything. You're on the ground, so your impact is wide. And if we have common understanding, we have a chance to beat this pandemic. So thank you very much. I just wanted to start with some background so that we put everything into context. We all know that this disease, COVID-19, is caused by a coronavirus. So viruses have different names. This particular one is called corona because it has a corona, a crown. It's got a crown of spikes, as you can see on the left-hand side, giving it a crown like that of a king or a queen, and that's why it's called coronavirus. It's not absolutely new. We have known coronaviruses all along. Coronaviruses are flu viruses. And the important thing in this context is not just that they're flu viruses, because they've been there all the time. But when they cause pandemics, then they become of global and public health importance. There have been three pandemics, worldwide pandemics caused by this virus in our lifetime. The first was in 2002, and it caused the disease called SARS. SARS is severe acute respiratory syndrome. And that virus came out of Asia, China specifically. Exactly 10 years after that first pandemic came another coronavirus that caused a disease called MERS. MERS is Middle East respiratory syndrome, and that came out of the Middle East. Now, 7 years after that came another coronavirus, which has caused the disease that we are now calling COVID-19. COVID-19, of course, stands for Coronavirus Infectious Disease of 2019. So you can see that the second pandemic came after 10 years, but the third pandemic came just after 7 years. That should make us aware that the fourth pandemic may come even less than 7 years. Perhaps we'll get it in 5, in 4, in 3, who knows? That's an important point. And then just an overview of the global situation. As of last night, there were 212,155 confirmed cases. I stress confirmed because they're only confirmed if they've had a test. Tests are expensive. Tests are not readily available. There are lots of people the whole world over who have no access to testing. So this figure could just be a tip of the iceberg. There could be many, many more cases. And the same applies to the deaths. The recorded deaths worldwide are 4,655,118 confirmed, many more not confirmed. And the total vaccine doses received the whole world over, all vaccines, Sinopharm, Sinovac, Pfizer, all of the doses, first, second, put together, are 5,733,157,409 as of last night. That's the global situation. But we're in Zimbabwe, so we want to contextualize it. What is the situation in Zimbabwe? Again, as of midnight last night, the total number of recorded, and again, I stress, confirmed, were 126,269 cases. Total number of deaths confirmed to be COVID-related, 4,538. But many, many more deaths out in remote areas where you as NGOs probably serve. People who have died and never had the test also died of COVID-19. With respect to vaccination, total that have received the first dose only is 2,845,148. And the total that are fully vaccinated is 1,863,136 people have been fully vaccinated, both doses. And we know our population is ranging between 13 to 14 million. So 1.8 million is not even, we're not even 20% yet. What is the situation with this SARS-CoV-2 virus? Why are we saying CoV-2 now? We're saying CoV-2 now because we said the first one was in 2002. This is now the second one. This second virus has caused 3 waves, and these 3 waves have been related to 3 different variants. The Alpha variant, or the original variant, was in March 2020, because our first case in Zimbabwe was reported in March 2020. The second one was in November to January, peaked around December 2020, and that was called the Beta variant, originally referred to as the South African variant, which is not politically correct to refer to it as having been from a particular country. So it's the Beta variant, the B1507Y. And then this year we had the terrible, dreadful Delta variant that arrived in Zimbabwe around May 2021 and then peaked around July 2021. So that has caused the 3 waves that we have experienced here in Zimbabwe. What does this tell us? It tells us that this virus is very clever and can change again and again and again. So it's not over until it's over. We're dealing with the Delta, but people have already reported the Eta variant, the Gamma variant, the Kappa variant, and Lambda variant. You can see all these are Greek names. They're being ascribed letters of the Greek alphabet. The Delta variant is what has caused particular havoc, not only everywhere else in the world, but for us, of the 3 waves I mentioned, the 3rd wave has been the worst for us, caused by this Delta variant. So I just want to say a few words about the Delta variant. The situation right now, everybody's asking, why are we still talking about COVID? The numbers are so low now. Hasn't COVID-19 disappeared? Indeed, we are at the end of the 3rd wave, but we know for certain that there will be a 4th wave. Based on epidemiological projections, there will be a 3rd wave. So we must continue to educate each other. We must continue to remain aware. As I said, this virus can keep on changing, can go on to Eta, Gamma, Lambda, Kappa. But so far we are on the Delta variant. And people are saying, okay, this doesn't apply to us because we've already had the disease. We've had it. So does anything matter? It does matter. Because if you've had COVID, can you get it again? Absolutely. So what do we know about prevention? We know that there are 4 pillars. There's social distancing, there's masking up, there's sanitizing and washing hands. But most importantly now, which is the focus of our discussion this afternoon, is that we now, unlike the 1st wave and the 2nd wave, we now have available to us vaccination. As I said, the Delta variant is what we are currently, most of our numbers are the Delta variant, and that has caused most havoc. What is so important about this Delta variant? Well, the Delta variant is far more infectious. is twice as infectious as the beta variant, and therefore you can catch it at a much shorter distance than the previous beta and alpha variants. So we should really be talking about increasing social distancing, not only just to 1 meter, but possibly to 1.5, even 2 meters. We also know that the Delta variant is 1,000 times replicates much faster, and therefore the viral load is much, much higher, and people get sicker faster and sicker as well. Also, the Delta variant came with the different symptoms from what we had been taught in the first and second wave. The symptoms are more varied and more vague. Also, the Delta variant this time around affected children and young people, whereas in the first 2 variants it didn't. And then, of course, as we all know, everybody on the platform today knows a friend, a relative, a spouse, a child, a parent, a neighbor, churchmate who unfortunately has succumbed to this. So the death rate has been much, much higher. And this is just a chart which shows some of the symptoms of the Delta variant, some which you would not normally associate with flu, like diarrhea. You don't think of diarrhea with flu, a long-lasting headache. Yes, you can get headache in flu, but generally just for a couple of days, not long-lasting. Vomiting is generally not considered a symptom of flu. Sore throat maybe, blocked nose, yes. But then also aching muscles and feeling very, very unwell, just feeling tired. If you have any of these symptoms, suspect COVID. So let's just go on to the 4 pillars, ending with vaccination. First of all, social distancing, stay home, no visitors, everything done online like we're doing right this afternoon. We are working, we're communicating online. You can work, you can worship, you can play remotely, avoid funerals, avoid eating in public. And if you must go out, increase the distance to 2 meters, as I said before. The disinfection protocol, very important for NGOs, because you have a lot of outreach, you have a lot of workshops and things like that. So you want to always protect yourself, never leave home without your own sanitizer, wash your hands and your face. With the Delta variants, we are saying and face, not just the hands, but also the face, and it must be with soap, not just water, but with soap and water. Everybody entering your space, whether it's your office, your cubicle, your house, your car, must sanitize, wash their hands, and then, of course, practice the cough or sneezing etiquette when you are together, moving in a vehicle from point to point, etc. And then masking up, we know a lot about masking up, but just new things that came with Delta variant is that you wear a mask with everyone except from your own bubble. Your own bubble means people who live in the same household as you. Even if you are at your own house, if somebody who doesn't live with you comes to visit, you must then wear a mask. If someone in the house is sick, everybody must wear a mask, including the person who's sick, unless they are too sick to wear a mask. Wear the correct mask, wear the mask correctly, must cover the mouth, must cover the nose, must cover the chin, and make sure that there are no open spaces on the sides. Double mask up in high-risk areas, and perhaps wear a face shield on top of the mask if you are in a high-risk situation. And finally, what we want to focus on, the last pillar that we have available to us to prevent this deadly, deadly disease is vaccination. And for us here in Zimbabwe, this is actually a photograph of me being vaccinated as a healthcare worker. Obviously, we were the first group of people to be vaccinated when there was a lot of anti-vaccination sentiment. So vaccination arrived in Zimbabwe in March. That should be 2021, not 2020, sorry, March 2021. So there may be people on the platform who are saying, I've been vaccinated, congratulations. Do I still need all the things that you've just mentioned, the masking up, the sanitizing, the social distancing? The answer is absolutely yes. And at the end of the presentation, we'll see why. So the big question, lots of anti-vaccination statements, lots of fear, controversy surrounding vaccinations. So I just want to demystify that and explain in simple terms what vaccinations are available and what perhaps they do. So the vaccinations, I'll start with the ones that are available for us in Zimbabwe. We have Sinopharm, which was the first to arrive in March. By June, we had received the Sinovac. End of May, we had received the Sinovac as well. Around the same time, end of May, beginning of June, we also received the Covishield and Covax, which is produced in India and is exactly the same vaccination as the AstraZeneca. But as we all know, a few people got the first dose and the vaccine disappeared. So why did the Covishield vaccination disappear in Zimbabwe? It disappeared because it's manufactured in India. And at that time, when we had just received that Covishield, our first batch of the first dose, the numbers, the Delta wave then hit, and the numbers in India shot up, and the Indian government made a decree or a declaration that they would no longer be exporting any vaccinations to other countries because they needed to use them in their own country. So we never received the second shipment. And people who had received the first dose of Covishield had to start again with either Sinopharm or Sinovac. And much more recently, end of July, we received a donation from the Russian government, which is the Sputnik V. The Sputnik V is a donation from the Russian government, and we haven't actually purchased any doses. So possibly when the donated doses run out, that may be the end of that, and we will continue just with the Sinopharm and the Sinovac. But people will say, we hear on TV, we read on the internet, my daughter is in America, my sister is in so-and-so, they've had Pfizer, whatever. Yes, there are other vaccinations available elsewhere in the world, the Pfizer vaccine, the Moderna, the AstraZeneca, and the other viruses, Johnson & Johnson, which is available next door. So next door in Zimbabwe, where there's a lot of traffic between Zimbabwe and South Africa, you know, of course, that they have the Pfizer, which is a nucleic acid vaccine, and they also have the Johnson & Johnson, which is a viral vector. I'll explain that just now. But they also now have the Sinopharm. They stopped using the AstraZeneca, as you know, because of they found that it was not very sensitive for their population. So the question now, people will ask, okay, we hear these fancy names. We hear you talking about nucleic acid vector. What are all these differences? Well, there are three types of vaccinations. You can be vaccinated using just part of the virus. The brain or the nerve center or the CPU, for those who understand computer language, of the virus is the DNA or the RNA. Some viruses are DNA, some viruses are RNA. That is the nucleic acid. So some of the viruses, vaccinations are made just using the nucleic acid. And as you saw, I showed the first photo, is called the coronavirus because it's got these spikes on the surface. So some vaccinations just use the spike protein. Some vaccinations use the whole virus, but not directly. They take another virus and put it in that virus and teach that other virus how to make antigens. So it's like a surrogate, like a woman who can't give birth to a baby because there's something wrong with her uterus, but there's nothing wrong with her ovaries. Her ovaries are completely fine, but there's something wrong with the uterus. She can't carry the uterus. So you take her eggs and you put them in the sister, you put them in Mainini, you put them in Manawatete, whatever, who carries that pregnancy. But that pregnancy still remains yours because the eggs are yours. The vessel that has carried it is just something borrowed. So those are the viral vector where you use another virus to carry the SARS-CoV-2. And then finally, the traditional vaccinations, which we have always known, the Tajaira, where you use the whole vaccine to inject to elicit an immune response. So the purpose of vaccination is to elicit an immune response that is small and controlled, so that in the event that you do meet that virus, already you have antibodies on board. My soldiers, and that's the purpose of vaccination. So you do mount a response and you do get a little bit sick, usually nothing that you notice, but then you produce the antibodies. So those are the three. Part of the virus, using a relative or a surrogate virus, or using the actual virus. When we use the whole virus, there are two possibilities. You can use the whole virus dead, or you can use the whole virus inactivated, or you can use the whole virus live, but zikiswa its ability to cause harm, live attenuated. So I'll come back to that. So these vaccinations, which is which? The Moderna and the Pfizer are nucleic acid ones. They use part of the virus, the nerve center. In this case, they use messenger RNA. The AstraZeneca uses a different nucleic acid, DNA, which is double-stranded. The Johnson & Johnson uses the vector. The Sputnik, in fact, the Sputnik, that's incorrect there. The Sputnik is actually also a vector one. And then the Sinopharm and the Sinovac, which is what we are mainly using here, are the whole virus, and they are the dead virus. I really, really want to stress that the ones we are using here, Sinopharm and Sinovac, are the dead virus. The Sputnik virus is a vector virus, so it's not the actual coronavirus, but we use another flu virus as a surrogate. I know you can't see this because it's very small, but I will also be sending to Mrs. Musiwa this presentation on PDF, which is a WhatsApp version that you can circulate and read. So you'll be able to read when you have that WhatsApp version. But this one shows you, compares the different vaccines, which one is which, and I've already outlined which one is vector, which one is nucleic acid, which is the whole virus. It also tells you how many doses. Most of them are 2 doses, but Johnson & Johnson, which people have heard a lot about, for example, is a single vaccine. Another one made in China called CanSino is also a single dose, so you'll see that. But what may be of interest to you is the effectiveness. There are 2 words that you will have heard used in the literature or on social media: efficacy and effectiveness. Are they the same thing? Sometimes, but not quite. Efficacy refers to how effective an agent, a drug, or a vaccination is able to prevent a certain disease in a laboratory setting. That is efficacy. Effectiveness is how effective the vaccine is in preventing serious illness and death in real life. So this particular table, which you'll get, is talking about effectiveness and shows us that the Pfizer is top of the list with 95%, together with Moderna. AstraZeneca then comes in at 90%. The Sputnik, which we have here in Zimbabwe, is at 92%. So it's probably number 3 in the world. One of the differences with the Sputnik, it's 2 doses, but the 2 doses are not the same. All the other vaccinations that have 2 doses, the first one and the second one, you're getting the same thing twice. With the Sputnik, you're getting slightly different, because I said the Sputnik is a viral vector. So you're getting 2 different viruses that have been used as just to make sure that the effectiveness of the virus is very high. But everybody is interested in, what about the ones in Zimbabwe? On the table, you'll see CoronaVac, which is another name for Sinovac, and Sinopharm. Those ones are actually also very good vaccinations, but not as high effectiveness as the nucleic acid. So they come in around 80, 81, 82, up to 85%, which is still a very good coverage. When you get the table, you'll see that all the other ones below, there are many different ones in China, in Brazil, in India. Some of them even have an effectiveness of as low as 49%. So take heart in that the ones in Zimbabwe have high effectiveness. And also take heart in knowing that the ones that we use here are the whole virus. Why is that important? It's important because, number one, when you mount the immune response, you're mounting it to the whole virus, giving you full protection. Number two, they are the whole virus, but dead. So out of all the viruses in the world, in the world, they are the safest because the virus is dead. And lastly, number three, take heart, because the ones that we use here are using the same old technology that we have always known and used. When your baby is born, your baby is given BCG. That's the same technology as the Sinopharm, Sinovac. At 3 months, munoende samwana ku clinic ku scale. 3 months, 4 months, 5 months, you take your child for DPT, diphtheria, pertussis, tetanus, measles. 9 months they get measles. When they're starting school, you get the booster vaccination. That is the same technology. So what we have here is the dead virus, very, very safe, the whole virus, very, very effective, and old technology that is tried and tested. So finally, I will go on to my last part of my presentation, which is frequently asked questions. People say, who is eligible for vaccination? Well, so far, national policy is that all adults above the age of 17, so 18 and above, with no question. There's now a trial, a short trial that is being conducted on 14 to 17-year-olds. That's still at the trial stage. But above 18, if you are an adult, you can go and be vaccinated. People ask, I am breastfeeding, should I be vaccinated? Initially, we thought no. Now, excuse me, the science tells us absolutely yes, by all means. What if I'm pregnant? Again, initially it was no, but now it's a resounding yes. What if I have diabetes? Again, initially people were not sure if it was safe for diabetics, but now we know a lot more. And we know that we have the mortality data. I'm a pathologist, so I work in the mortuary every day. We do postmortems every day. And worldwide, we know that diabetics are very much at risk. Therefore, if you are high risk, by all means, you must get vaccinated. The only proviso or caveat is that make sure that on the day that you are going for vaccination or in the days around your vaccination, your sugar is well controlled, because the sugar can rise with the vaccine and with the infection as well. Lots of people in hospital dying because their sugars have become uncontrolled due to the virus. What if I'm taking ARVs? By all means, please continue to take your ARVs and go and get your vaccination. A lot of you NGOs will be working with people who are on antiretrovirals, so that's an important message. What if I have high blood pressure? Again, people with high blood pressure, cardiac disease, heart disease are at particular risk. So by all means, go and be vaccinated. But again, the same as with diabetes, make sure that your blood pressure is controlled at the time. What about people who have had COVID-19? People say, okay, I've had COVID-19, so I've mounted my own antibodies. The antibodies that you mount to the infection versus the vaccine are slightly different. So if you've had the infection, you still want to get vaccinated, and you are now much safer than everybody else. So as long as you're still symptomatic, usually you need to wait 4 weeks, go and get vaccinated. What about people who are testing positive because they want to travel or whatever, but they're asymptomatic? No, because even if you are asymptomatic, it means you've got the infection. You may want to know that 30% of people with SARS-CoV-2 or COVID-19 are asymptomatic. And 60% of the infections are transmitted by people who are asymptomatic. That's important for you, again, as non-governmental organizations that deal with large numbers of people. Keep yourself safe, even if people you're interacting with have no symptoms, they could still be carrying virus and they could still transmit it. So if you test positive, don't rush to a vaccination center because you can spread it and vaccination centers become hotspots. Is the vaccination a cure for COVID-19? No, absolutely not. It's a prevention strategy. So as I said, if you test positive, go into isolation until you are de-isolated following the WHO criteria, and then wait another 4 weeks, and then you can go and be vaccinated. But it won't cure you from the disease. Can I get COVID even after I've been vaccinated? Unfortunately, yes. It's not 100% effective, but Sinopharm is thought to be between 79, as I said before, to 85% effective. It's more effective against preventing hospitalization, up to 93%, and up to 95% for preventing death. So it prevents the disease, not so high. It prevents hospitalization, pretty high. Prevents death, very, very high, but still not 100%. And this is just a chart from United Arab Emirates showing the difference between cases coming into hospital. 84% were unvaccinated, 16% were vaccinated. Why did I choose data from United Arab Emirates? Because the vaccination rate was very high. At the time it was 71%, representing 91.8% of all that were eligible. But now it's even higher than that. Out of the people that were hospitalized, 89% were unvaccinated, 11% were vaccinated. Of the people who were admitted to ICU, 92% were unvaccinated, only 8 were unvaccinated. And of those dying, 94% were unvaccinated and only 6% were vaccinated. So we move away from United Arab Emirates data to University of Zimbabwe, our own data generated from our own unit in our university. This is from my unit. It shows you beautifully, the blue are the not vaccinated. That was very 90%, and then the red are people who had the first dose, which was about 3%. The second dose was 5%, and people who had second dose. People say, but how come second dose was higher? We actually stratified them, and many of them had kidney disease, diabetes, they had comorbidities. And then, of course, there was the purple, which was just under 3%, which was people whose relatives who came to the mortuary did not know whether their deceased relative had been vaccinated or not. It's an important message, again, to declare when you've been vaccinated, to encourage and to motivate others that you've been vaccinated. My very last part of the frequently asked questions is anti-vaccine. This when you're out in the field. Some people on this platform may also have anti-vaccination sentiment. So my hope and my prayer is that after this presentation, you will be convinced. But let's look at some of the things that we've heard as anti-vaccination. I'm in the COVID-19 National Experts Committee. So I serve at national level on the COVID Experts Committee. So we hear all these things. They come in from the different ministries. They come in from the different provinces. People say, I don't want to be vaccinated because I don't know what's in it. But you ask the question, a lot of people are hypertensive. They take HCT, they take nifedipine, they take losartan, they take amlodipine. Do you know what is in HCT? People get a sore throat, people get flu, they take amoxicillin, they take ceftriaxone. Do you know what's in amoxicillin? When you do get COVID, you will need an antibiotic called azithromycin. You may need tocilizumab. You may need remdesivir. Do you know what's in there? Suddenly you want to know what's in the vaccine, but everything else you take, paracetamol, that's acetaminophen. Do you know that? But you're happy to take it. Other people come in with, yeah, I'm happy with my child getting BCG, DPT, measles, because I know kuti it took 5-10 years to make it. This one was made in 1.5 years or less. But as I explained before, Sinopharm, Sinovac is all technology. And we have the track record. Smallpox was a deadly disease that killed so many people in the 1800s. People were just dropping dead all over the place, but we managed to eradicate. None of us on this platform know what smallpox looks like because it was eradicated before we were born. It was eradicated by the WHO insisting on global vaccination. Everybody had to be vaccinated, and that's how they got rid of that disease. It's now just in the history books. Other people say, well, no, I'm happy to be vaccinated. No Dairant, no Gashira, but not Sinopharm, not Sino. China. But I ask you, what in Zimbabwe, what in Africa, what in the world are we using that's not made in China? If you do get COVID-19, you'll need to be on a ventilator. The ventilator is made in China. You may need oxygen, everything, the tube, the mask is made in China. The cylinder is made in China. So what is not made in China? Why just this? Other people come in with a religious angle and they say, oh, it's not biblical, it's satanic to get vaccination. But people quote a verse out of context in Revelations about the mark of the beast. Nowhere does it say in that scripture vaccination. But we do know that the Lord has a track record of healing his people. We know in Numbers 20, the story of when the Israelites had sinned and the Lord sent poisonous, venomous snakes to bite them. And people were dropping dead, just like people were doing in the third wave. In the second wave, we knew Ningi, politician, doctor, whatever, famous person, celebrity has died. It was like that at that time. And people saw that, the whole population was going to be destroyed. So they cried out to Moses and they said, pray to your God to take away these snakes. The Lord didn't take away the snakes. He instructed Moses, who was a human being like you and me, to make a snake out of bronze and hang it on a pole. And anyone who is bitten can look up and live. That's Numbers 21, verse 8. This scripture in the Bible really tells us that the Lord God is the same yesterday, today, and forever. He remains the same. And he used a human being, a sinner. Moses had murdered somebody, the Egyptian. Moses had been born in a lowly place, hidden on a basket, raised up as an orphan. He was just like many people, many of us are. But he used him. He was not righteous in any way to make a snake. So it was something that was man-made that brought healing. And the scripture is so powerful in that the Lord could have said to Moses, make a dove. A dove was a symbol of peace. Make Wumba an angel. An angel brings good things or hope. But the Lord didn't. The Lord said, make a snake. The same thing that was biting them is what he used in a man-made form to be what brought healing. And that's what vaccination is. You take the same virus, you take it, activate it in a lab done by human beings and put it in, and it is safe. So it's not exactly the same, but it is a track record of how God has used man to bring healing and particularly use the same thing that was bringing or causing death to be the same thing that brought healing. Other people say, yeah, I'm happy to have vaccination. I understand all that. But why are governments making it a requirement? Because governments know that if they achieve herd, and that's why vaccination, you don't pay for it. A few private places are charging just an administrative charge to allow you to get it so that you don't have to wait in long queues. But otherwise, government has made it free. They have paid for the Sinovac, they've paid for the Sinopharm, because they know that if they achieve herd immunity, Just like herd immunity was achieved for smallpox, we have a chance to eradicate this disease, and we can go back to normal, to meeting, to socializing, to not wearing masks, to go to church, to do everything, to travel as we always wanted to do. They also know that if they eradicate this disease, they reduce the burden on healthcare services. That's why even the expanded program of immunization, you don't have a choice. When your baby's born in a hospital, in a clinic, you have to have BCG in Zimbabwe. It's the law. Your child has to have immunization when they're 3, 4, 5 months, and that's recorded on the Road to Health card because it will reduce the healthcare burden. People also say, I know someone who was vaccinated who died of COVID. Yes, we all do. And on my chart, I showed you 4.8%, just under 5%, in the green of the pie chart, people who had the vaccine. Yes, some people will die despite the vaccination, but that should not stop you from being vaccinated. It's just like saying, would you stop taking insulin because you know there was a diabetic somewhere who was on insulin who died? You stop taking antibiotic because you know there was a person who had pneumonia somewhere, took an antibiotic and died. Nothing is 100%. And the last one that I think I want to end on, which is, I think, very pertinent for NGOs, because a lot of NGOs deal with human rights. People say it's an infringement of my rights to insist that I must be vaccinated to go this place, to do this place, or whatever. Well, can I ask you, is it an infringement of your rights that the South African government requires that to enter their country, you must have a passport? You must have an identity to protect us all. What about a visa? Countries must vet you to see if you're the right person to protect their citizens. What about going into a hotel? NGOs often have workshops, etc., in hotels, or you go out on outreach, you stay. When you enter, it says right of admission reserved. If you're coming in without a shirt, with a bare chest, they can keep you from their hotel. They have a certain decorum that they want to maintain. What about switching off your phone on a plane? It's your phone. Why must I switch it off? To protect the common good, so it doesn't interfere with signals that help aviation to keep us safe when we're in a plane. What about getting a yellow fever vaccination when I want to go to Congo, I want to go to Burkina Faso, because they want to be safe. They want to keep their citizens safe from people coming from yellow fever zones. What about wearing a mask? You go to a shop, you go to a building, they say you have to wear a mask. Is it an infringement of your rights? It's to protect the common good. What about having your temperature checked? Can you say, no, I don't want to have my temperature checked. It's against my rights. It's protecting the common good. A PCR test, if you want to get on a plane to travel across the border, it is an infringement of personal rights in order to protect the rights of everybody else. What about everyone else's right to safety? That overrides your individual right not to have the vaccination. And as I close, I just caution us all to beware. Beware of false information. There's so much false information on the net. There's so much false information on social media. Beware of conspiracy theories. This is one advert that was flighted for 24 hours. A company was advertising a Ziverdor kit that was supposed to treat and prevent COVID-19. And they said in this kit, there's zinc acetate, there's ivermectin, there's doxycycline. Then they put the WHO logo on the side. And then they put, of course, the cost, only US $10 per treatment. And of course, WHO had nothing to do with this company. And immediately they issued an MDPCZ, MCAS, all the regulatory organizations, as well as WHO, issued a strong warning, and they had to take this down. So be careful and beware. And in closing, Madam Chair, I just encourage us all to be responsible citizens and do the right thing. Get vaccinated, keep yourself safe, keep your loved ones safe, and keep everybody else safe. May God bless you and may He keep you. Thank you.
Thank you for following through with the presentation. We hope it was educative and informative to you, our viewers. Don't forget to like, subscribe, and click the notification bell. Also remember to follow the COVID-19 regulations put in place by the government to minimize the spread of the virus. Let us stay safe, social distance, and mask up. COVID-19 is real. Thank you and goodbye for now.